Centre. What's good about this is I don't have to do the usual housekeeping, do I? So about the fire alarm or where the toilets are or anything like that. But I am going to set some rules around Zoom. So we haven't done this before, so this is the first time. So if things go wrong, all I can say is I'm really sorry and we'll try and sort it out. But the technology is difficult and not everybody is as techie as others. So we've got different people in different parts of the building that I might have to help out at different points. But in terms of what I've seen that has worked really well with other bigger Zoom meetings has been that everybody mutes themselves and switches off the video unless they are the speakers themselves. So, and we would ask that everybody who has got any questions, put them in the chat function. And it's something that I will pick up later on. We've got a bit of time there for questions. Has everybody had the, I'm hoping everybody's had the programme. If you haven't, I'm just going to run through it really quickly. So I'm opening it. Then we're going to hear from Jill Broomhall, who's from Cheshire East, who I have admitted, so I know that she is in there somewhere. And she's the Director of Adult Social Care at Cheshire East. And then we're going to hear about the research itself from Corinne, who was the researcher involved. So she's going to do a session for about half an hour. And then we're going to hear from Irish Community Care about working with Gypsy and Traveller communities. And then we're going to hear from one of the community researchers about why they got involved, what their lived experiences are. And then we're going to pick up the questions that are in the chat function. Or if anybody wants to put their hands up, and hopefully I'll be able to see you, and then I can ask you to say your question. And then we're going to have just closing remarks and next steps from Wyn at the end.
We're just getting a bit of buffering as well. I don't know if that's, if everybody else is getting that. No, the buffering on the actual stop-start with the picture sometimes.
Right, I'm muting Russell just because I think TK will sort that out for me, if you can. So yeah, as I say, if anything goes wrong, I'm really sorry. But we'll try and sort it out as we go. I mean, for everybody, it's new. I mean, we've been doing Zoom meetings quite a lot, but we're not doing the sort of extent of this where we've got a lot of people. So we've got 2 people waiting to be admitted. So we've got 52 people online.
While you're doing that, Chantal, shall I just ask at the end? We're going to ask for some commitments to what you've heard today. So, in order to allow that to be a really proactive kind of integrated process, can you start thinking about kind of as you're hearing stuff, oh, I could do that. You can either make a note in the chat or make a note at the end. And for when we come back for the last final thoughts, it's going to be, we're going to be looking for some really key commitments going forward. Because obviously this is the start of something. It's the end of the research, but it's the start of something else. So please, you know, be thinking proactively about what this means to your organisation, what this means to your staff, and what it means to partnership across Cheshire. So please, they're the 3 key points. And what, you know, we'll look at the practicalities of that. The other thing, just to note, is that we are looking to do some workshops after this as well. Hopefully, kind of a little bit more socially integrated, a little bit more accessible, kind of face-to-face sort of stuff, as much as you can do face-to-face. But in the meantime, you know, we'll all hopefully take something away from this other than the next hour and a half of our lives and some kind of notes of data on a pad and stuff. So it's a live document. We want it to be a living process. So please,
great.
We're welcoming that.
Thanks, Wyn. Yeah, most of you, I mean, probably know the background anyway to it, but for those who don't, back in 2006, we actually had some funding through Change Up, which was a funding programme at the time, and it was looking at developing a network for Gypsies and Travellers across Cheshire. So when we went out to talk to them about what they wanted from a network, we realised that actually this could be a lot wider for other agencies, and it was a real opportunity to do a proper piece of research. So that's the old Here to Stay report, those who remember it. I mean, then about 10 years later, I was chatting to Wyn because they were doing a little piece of research as well. They'd had some funding for that. And then we discussed about how the fact that Here to Stay was still the only key piece of research that people were using, and wouldn't it be good if we could do a refresh on that. Now, it's taken several years for us to be able to actually get the funding together, but a variety of organisations have come together, given us the funding, and we've been able to do a refresh on this. So it's taken us some time. We were hoping to launch it back in April. We had a physical launch then. Obviously, with COVID, that this has now happened, so it's a little bit late. But as Wynne says, hopefully this will give us the opportunity to have something that's ongoing. So whilst we have the launch now, that's not the end of it. We want to try and follow up with that with further workshops later on, when we can actually have a physical presence and kind of bring people together. This is the report itself. We've got hard copies available. What we're going to do is we're going to put a link up afterwards, so you can download it as a PDF. But people who want to have hard copies, we've got boxes of them here at the Unity Centre, and I'm going to give some to Wynne as well, so that she'll have some for Irish Community Care as well to be able to give out. I mean, basically, I think that the workshops are going to be important, because at the end of the day, this is what we want. We want to affect change. It's not, we don't want it to sit on a shelf. We want it to actually make a difference. So. And now I think I have gone over a little bit, but can I introduce Jill Broomhall from Cheshire East Council to talk a little bit about why this work's important, and then I will pick up in about 10 minutes. Is Jill around? Hello, Jill. Virtually.
Hi.
Thank you. Can I hand over to you now? Is that okay?
That's fine, thank you.
I'll mute myself.
So good morning, everyone, and thank you so much for inviting me to speak today. I'm very happy to be here. So my name is Jill Broomhall. I'm Director of Adult Social Care with Cheshire East Council, and the welfare of Gypsy and Traveller communities sits under my portfolio. It is an area of work that's very close to my heart. If I tell you my family background is of scrap dealers and horse dealers, you'll probably understand why. Thank you initially to Cheshire Halton and Warrington Race and Equality Centre and the Irish Community Care for commissioning this piece of work. It's something that we've eagerly awaited in Cheshire East and across the team. I don't think I could start without paying tribute to Wynne Lawler and our own Dawn Taylor for the work that they have done. I'm so impressed with the work that Dawn Taylor does. She is an absolute star, so thank you, Dawn. And to my own team of Sandra Murphy, who's head of safeguarding, but she manages the welfare aspect of Gypsy and Traveller communities. I'm also very keen to see if we've had many changes from 14 years ago. The level of discrimination that Gypsy and Traveller communities face is just dire. And as a social worker, I understand about how people internalise what is said to them. So the level of discrimination, both in the language and physical discrimination and hate crime towards Gypsy and Traveller communities, it's not surprising, is it, that we have the level of suicide that we have when people hear and are told the level of hatred that's directed towards them. And people do internalise that. So suicides among the Gypsy and Traveller community is so high and shocking. So shocking. The health inequalities as well. We see terrible health inequalities in the Gypsy and Traveller community. And looking at, you know, we have so many good intentions, but at the end of the day, so what? So what? We can have these good intentions. What we need to look at is what are we going to do about it? I'm very pleased that within Cheshire East, we have the support of the majority of our elected members who will stand up for the communities and do everything to make life easier for them. I'm sad to say what we don't have in Cheshire East is a transit site, but we are working on that. I think that for for all of us, what we need to do is to look at the recommendations of this report and to actually be very serious about taking them forward. And I know that within the team that Dawn heads and within my own teams in Cheshire East, we are keen to look at how we can move forward in a meaningful way, not in a patronising, tokenistic way, but let's try and move forward in a meaningful way. I chair the Safer Cheshire East Partnership Board, and for me, I think one of the things that I would want to see going forward for that board is that we raise the issue of hate crime, that hate crime becomes a key aspect of the work we do. We look at hate crime from all areas, but we need to be very serious about how hate crime is directed towards Gypsy and Traveller communities, not just in our areas, but across the country and beyond. I think recently there was a case in Ireland where a house was burnt to the ground because the neighbours realised a Gypsy Traveller family were moving in. And that is shocking, absolutely shocking. And we then look at those people who are travelling the country on sites where they're having to use brown water for drinking. And that can't be right in this day and age, surely. Surely we are a much better society than that. So I'm very happy to be here. I'm concerned about what the outcomes of the report are going to show us. Hopefully, we can see massive changes from 14 years ago, although I'm probably being very optimistic. But I think it is a commitment from all of us that once we've read the report, the so what becomes, what are we going to do? What are we going to put our name to and stand up for our Gypsy and Traveller community? So thank you all so much for inviting me today. And I'm very, very keen to hear what happens going forward. So thank you, Chantal. Thank you, everyone.
Thanks very much, Jill. That's great. Now you are going to hear from the actual research itself, what actually it says, what the recommendations are. So I'm going to unmute Corinne, and I think I might have to go and help her share her screen as well. You need to unmute yourself, Corinne. Done it? Yeah.
Yep.
And I think she's going to share her screen. I need to make you the host, don't I? So, right, I'm passing the host over to Corinne so that she can share her screen because she's got a presentation to go through.
Is it this? Okay. So can people hear me? I hope that they can. I'm just bringing my presentation up.
Yeah, just to confirm we can hear you and we can see the presentation.
Okay.
Yeah. Brilliant.
Okay. Okay. Hi. Forgive me. I'm a Zoom virgin, and I haven't done a presentation in this format before. And I think Chantal, if you can't hear me, Chantal will know about that. At the beginning, thanks very much, Jill, for what you've just said. It's very positive to hear people talking about wanting to do something in the future. First of all, I want to say thank you to other people that helped me with this research, because there may not be time at the end. So great thanks to my co-researchers and to Irish Community Care for facilitating entrance to the community, and Chantal for all her wonderful support. And thank you to the funders as well for allowing this research to happen. I'm going to talk about the shape of the report, and there's time for questions later. And please forgive me, it's only a snapshot. The report is very full, there's lots of data. So when you've seen that, if you have extra questions, Chantal can pass them on to me. I can respond via email. And there's plenty, today I'm going to just talk in very broad terms, but there's plenty of, Gypsy Traveller voices are really important. They're a very important part of what we've been doing. And there's plenty of those in the report, and there's plenty more that I think we should probably publish somewhere else, because they're really powerful. It's very powerful data. So let's get started. I'm hoping my slideshow is going to work. Okay, so I'm going to talk about the shape of the research in the first instance. So my brief, I was involved in the 2006 research, and it's my great privilege to have been involved also in this one. And my brief was to update the work, to address gaps that we found in the 2006 work. So we didn't have enough men, we didn't have enough Irish travellers or travellers in general, and we hadn't really interviewed many people roadside. So we were bearing those things in mind when we were constructing the work. And also I was asked to make the work comparative and collaborative. So the former work was and I think Chantal mentioned this actually, we were looking to get a network going, and so the research was a sort of byproduct of that. In that piece of work, we upskilled Gypsies and Travellers. We trained Gypsies and Travellers to collect data. I trained them, and I supported them in collecting their data. And this time we hope to continue in the same way. I think we also hope that we'll be able to interview some of the same people. But things didn't quite work out that way. So I think there's been quite a changing landscape. And respondents, lots of respondents have moved on. Unfortunately, lots of people had actually died. And the issues affecting communities have changed. And we found that people weren't as keen to be involved in being trained, and we had to sort of adjust our strategy. So also we found that events impacted on whether people would like to be involved or not, life events. So people are leading quite stressful lives. I think that Jill already mentioned that. And also people perhaps had a lack of faith in being involved, because they saw that nothing much happened from last time, and I understand that. And also people were impacted by, I think Jill mentioned suicide. During the course of the work, the suicide rate was, amongst Gypsy and Travellers, was hard to understand. I think people were perplexed, and people were grieving. So in Ellesmere Port alone, during the course of the work, 97 adults and 200 children were affected by suicide and other deaths. And we had also the death of a community leader in Widnes, which also impacted on the work. So a little bit of background to the sample then. We held 5 consultation events and 6 site visits. And in the end, because we had to change our strategy, I wanted to meet people myself, and I took part in collecting the data. So I had quite a different role this time. And so my presence was in the Gypsy and Traveller drop-in in Ellesmere Port in order to come into contact with people, and I was there for 12 weeks. So at the end of the day, we had 4 community researchers who were trained by me, a member of Irish Community Care, a staff member who was a wonderful, someone's used the term trust navigator, was a wonderful trust navigator for me, gaining sort of entrance to communities, and 2 Gypsy and Traveller advocates, and myself then as lead researcher collecting data. So just a little bit about how the research looked. So data was collected via face-to-face interviews, and we used a structured questionnaire, and as far as we could, we kept to the same questionnaire as last time. And we looked at 9 domains, the same domains that we looked at in the first questionnaire. And although it was structured, we had dialogue boxes to capture lived experiences. And I think we've been quite surprised at the amount of information we've had via those dialogue boxes. It's been wonderful. And data was collected in people's own homes and via the drop-in service. It's quite hard to, in this context, I don't think you can talk about the type of samples that people quite often talk about in scientific research, because we don't know the population, the numbers of the population that we're choosing from. And also we want to speak to people, and that can be difficult to get people to participate. So in terms of trust and rigour, I think, which are important concepts in research. So the trust that we had with the community was through the involvement of these trusted intermediaries, Irish Community Care and members of the community. And I offered research training to those people and support, which added to the rigour of the work. And the way we proceeded was to review the sample. We actually looked to see that we got a good spread across age and gender and where people were living and areas of the boroughs that we were working with. And we positively targeted people to fill the gaps from last time. And we had a method for assessing quality as well, and it was in the last piece of research. So on the questionnaires themselves, we asked the interviewers to assess how well people had were engaged in the work, and to look at the what was the context of data collection. So quite often members of people's families would be there, and that may have impacted negatively or positively, and we tried to get people to assess that. And out of the 92 interviews that were done, those interviews were rated 5 or above, where 10 was the best it could be. So I was happy with that. And 2/3 of interviews were assessed, or interviewees were assessed as fully engaging in the process, which again, I think is really positive. So who did we speak to? A little bit about the sample. So in terms of gender, age and ethnicity and belief, and what I've done here is to, and obviously you'll see the report yourself and you'll see the actual numbers, but I've tried to give you a taste of what a typical respondent might look like in terms of numbers anyway. So a respondent was most likely to be female, under 40, a traveller, and follow the Catholic faith. And I think the youngest participant we had was 16 and the oldest 83. So, and there were 159 children under the age of 19 associated with the people that were interviewed. In terms of location, domicile type and nature of the household, people were most likely to live in Chester, West and Chester, in a van or a trailer, on a private site and with a spouse and children. And we asked people also how happy they were where they were living. And the majority, 96 out of the 125, said that they were happy where they were living. I want to say a little bit about the notion of permanence, which confused me, I think, at the time. So there's a part on the questionnaire where we ask people to say whether they've got a permanent address. So the first thing to say is that most respondents had lived at their address for less than 5 years. And more than half said that they still travelled. But also 35% of people said that they got no permanent address. But in other parts of the questionnaire where people actually talked about their association with different areas, that didn't ring true, because actually many people had, you know, over 10 years links with an area. So I asked about this. I went back to the steering group and I asked for an explanation on this. And it was explained to me that part of the language often in travelling communities is to always talk about moving on, and so we've called this a cultural leaning to moving on. So I looked at other types of indicators just to check this out, indicators of permanence like registration with a doctor and dentist and school enrolments, and all of those indicated a high level of permanence. So it's just a little, I was intrigued by it. I'd not come across it before, and I think it's an interesting observation. Okay, so in terms of points of comparison then with the 2006 research, the sample's bigger, there are still more women than men, but we reduced that differential. The age structure was also similar, but the median age was slightly older. The location and domicile type was roughly similar, and it was still the case that the majority of people lived on sites. The thing that was different is the ethnic mix. So there are now more travellers than gypsies, when this is a reversal of the position in 2006. And I think largely due to the help that we've had from Irish Community Care and the fact that we were trying to target that change from the last research. Okay, so something now just about people's lived experiences. So we asked people what they did for a living, and people were just so much more forthcoming about the issues around their jobs, about their finances than last time. And this was one of the issues that we were told was a no-go area. Please don't ask people about their earnings or what they're doing. So we didn't have much information last time. So we've got a bit more this time, which is great. So 86% said that they got a national insurance number. And it's still the case that people will be either self-employed or caring for children. And those two types of occupations accounted for 2/3 of all responses. In terms of benefit receipt, there's been a change, I think largely due to people who are assisting people to apply for benefits. And we made a concerted effort from the last research where we were aware that people just weren't claiming. So Irish Community Care had their drop in, and I know that other people are helping people claim benefits. So 80 respondents said that they were in receipt of benefits. I think it was hard to, I've got less definitive information on what type of benefit people are on, because people didn't always know. They just were on benefits. They said they were on benefits. They didn't always know which ones they were. So we have got some data. It's not very robust in that area. People, however, still need support with claiming. And by the way, the increase in benefit claiming it's 1/3 more than from the last research. So I think people still have problems receiving posts and sending posts, on handling their monthly payment, on providing self-employment records with overpayments and with penalties. And from sitting for 12 weeks in the drop-in, I just saw how even one of those things can really mess with somebody's lives. And you know, several people just had no income at all because of things that had gone wrong in that claiming process. And luckily, you know, Maya was there to help them, but it's still, it's not nice for people, and the system is very, very complicated and hard to navigate. A little bit about links with education. So 61% had current experience of local educational services, so this was via their children, and mainly it was through primary school, but also through homeschooling. There were only 7 people at high school, so I think there's still, it was apparent that people, from what people said also, that children were going to primary school and not going on to high school, and 2 people in college. So, and I think we did, some people did comment that some of their children had gone on to university. I think there were 3 in that case. And a really positive thing this time was that people wanted to tell us about their own education, and very often that was a bad experience of education, and that they had carried with them. But also the positive side of that was that people, they really recognised the importance of education for the younger people in their families. And sadly, they lamented that they didn't have the chance to have an education, and there was a sizable minority that actually commented on that and said that they wished that they could have done that too. Another positive thing is improved treatment from schools. So generally people were very positive about schools. I think there's a feeling that things have changed, that schools are really hot on discrimination. Once you mention it, that they will have no truck with it. And some people did mention that it was hard to get a place initially, but after they have got a place, that they were very pleased with schools. So that's really positive. A little bit about health and welfare. So we asked quite a few questions about health and welfare, and this is just really a snapshot of what we asked. You'll see more in the report. Last time we had a good level of registration with GPs, and this time it's even better. Most people are seeing a GP that's only about 2 miles from their home, so that's really positive. There was a problem last time with dental registration, and again, that's I think we've got about 50% registered. Many people aren't registered in the locality; they may be 10 miles away. Some people have dentists in the south of England, but it's still an improvement on last time. We also asked people, do they use any other type of health service? And top of the list was walking clinics. They were the most prevalent. Quite often it was women with children who they were worried and out of hours, and they would use those services. I think last time many people were using A&E, and that didn't really come through this time, apart from men who were working away. So many men said that they may get injured when they're working, so they use A&E then and were positive about the response they'd had. We asked about satisfaction levels with the range of services, but in terms of health and welfare, there were high levels of satisfaction with hospital services and doctors. We asked about health conditions, and mental health problems came out top of the list by far, followed by muscular skeletal problems. They were most commonly cited. So there were 113 mentions of health problems. And when we asked people about health problems and their relatives, again, mental health came out top of the list. So that was when we asked the general question about health conditions. When we asked about mental health, and from the last research, we were concerned about high levels of stress, but we asked some particular questions this time. And the results reveal that mental health concerns in almost half of the sample, and that in 2/5 of people, there are debilitating symptoms that they're having for more than 3 days a week. And in addition, respondents indicated their worry and concern about the rising suicide rate in the community and problems with substance abuse. A little bit now about, I've called it inclusion and exclusion. Okay, so we asked people how involved they felt with their local community, so with the Gypsy and Traveller community, and we asked them to rate this on a scale of 1 to 10, 10 being the most involved you could be. And perhaps not surprisingly, there was a high level of involvement in Gypsy Traveller community. People were positive about that, and I think 84 people rated this 6 and above. And it was the reverse was the case in mainstream communities. So people felt a low level of involvement, and 86 people actually rated this 1 to 5, so almost the complete opposite. There's an interesting observation though, that it depends who you liaise with in the mainstream community, and somebody said that, you know, if you have a positive interaction with someone from the mainstream community, that this can go a long way to feeling involved. And the example that was given were children joining a boxing club, and it's an Ellesmere Port example, but this particular mother said it's great, and you know, we really feel part of what's happening there. And I think that's an interesting observation to hold on to in terms of perhaps we make small steps forward in terms of people's involvement and relationships. So I mentioned that we looked at satisfaction with services. So we asked people what they were satisfied with, dissatisfied with, what they're ambivalent about, and perhaps what they, the services that they didn't know anything about. So we asked respondents to rank their satisfaction, and the highest rates, perhaps not surprisingly, were with people's own communities and their Gypsy and Traveller neighbours, and doctors, and I think I've mentioned that before, their landlords as well. The lowest scores were for businesses, the wider community, and the police. There was uncertainty about several important services: mental health, health visiting, and the benefits agency, which suggests a lack of knowledge about these areas and perhaps lack of exposure to these services. And that's of particular concern, isn't it? Because of the highest of mental health. So that certainly needs looking at. It's sort of perplexing. People didn't, and in addition, on another question about help for relatives who had mental health problems, people seemed unaware of what services their loved one was actually receiving. So concern about community issues. This is the area of the questionnaire that when we consulted the community about what questions should we ask in this work, things that were taboo the last time that they said just don't even go there, people are saying please ask, and these things are really important. Things like domestic violence, alcohol and drug abuse. And so we built this into the questionnaire. We had a list of things and scope for people to actually add any other things that they were concerned about. And this was a very well completed area of the questionnaire with lots of personal examples. So drug and alcohol abuse, suicide, domestic abuse, family breakdown were all scoring quite high in the list of things that people mentioned, but also loss of heritage, homophobia and grooming, grooming and sexual exploitation, and perhaps associated blackmail with that, which was shocking to hear, I think, and several people did mention it. A quote from somebody: "I still keep in contact with some of the community, and drug abuse is terrible, and so is sexual exploitation of both young boys and girls, sometimes leading to suicide." So there's someone's actually making a link there with some of the difficulties in the community, and possibly that's linked with suicide. And these things need investigating, and were shocking to hear. I'm going to talk about discrimination in a moment, and Jill mentioned how shocking it is, and that's the word that I will also use. But before I do that, I just wanted to talk about people hiding their ethnicity. So we asked, I know that Wynne fought very hard on monitoring forms for a category for Gypsies and Travellers, and that obviously would help with us knowing more about how many numbers we have. So we did ask a question about whether you would fill that, whether you would complete that part of the form. And only 50 people said that they would. So a sizable majority said that they wouldn't. And people had reasons why, and they were to do with differential treatment when they actually put down their ethnicity. And some people actually said, I weigh it up. Sometimes I will. And sometimes I feel it'll be disadvantageous to me to do that. So I just think it's an interesting comment. And just a quick quote: "I've suffered racism all my life, and I feel I am treated differently if people know I'm a traveller." And there were many comments like that. So about discrimination. So we asked respondents to reflect on their discriminatory treatment and racist abuse and attack, and sadly it was the most comprehensively completed section of the form. I was gobsmacked. The day I sat down to read and to analyse, that was a difficult day. The things that people had to say, the awful things that are happening to them every day, the fact that people are almost accepting that this happens to them and that there's no way out of it. Things like people spraying you with an air freshener because they think that you smell, the terrible things that people have said to them, and obviously the violence that some people face. So there's so much, I think, in that section. We could only put some of it into the report, and I think perhaps we need to do more with those stories that we have. So 93% said that they'd been treated unfairly, but half of these said that the incidents had happened in the last year. So these weren't things that had happened years ago, they were current things. 14% said that they'd experienced physical attack. And the incidents have an impact on people and their families. I think Jill said the same thing, long after the event. So this stuck with me. This is only a short quote, but my mum was attacked as a child. She was very scared and never forgot that experience. So you can see how that might pass on from generation to generation. People, they stay. I think that Jill said the same thing, that the things that have happened to them, the language that's used sort of stays in people's psyche and affects their self-esteem. It's no one can feel good in, as far as I'm concerned, in those circumstances. And also, sadly, most people never seek support or help. And some of the explanations for that were that they felt that they hadn't been supported in the past, so there was no point. So I think of 94 incidents in the past 12 months, only 16 people said that they'd reported it. And, you know, people use language all the time about not being listened to, not being believed, that no one would care anyway. And so those feelings are quite commonplace. And people use language like, I mostly don't bother to tell anybody. I just let it slide. It's just name calling. So minimising these awful things that are happening to them. And I'm sure that Russell later on will say more about this. And finally in this section, stop and search. So a third of the sample said that they had experience of being stopped and searched by the police. And half of these people said it had happened in the last year. And that is an increase on the last piece of research. And 34 people said that they were not, so we asked people, were they clear about why they'd been stopped? And 34 people answered saying, no, they weren't, apart from saying, it's because I'm a gypsy, it's because I'm a traveller. Somebody said, I've been stopped at work, going to work, looking for work, any excuse for them to check you out. And there were plenty of responses like that. One positive was the fact that now you can have your insurance and all your car details on your phone. So a few people said, it's easier because I've got the documents there and I can just show them straight away. But I think it's still an issue. So, making sense of the findings. So building on the 2006 findings, one of the things you wanted to do is to fill the gaps. So we have got more men in the sample, we've got more travellers, and it was still hard to find people roadside. I think even harder now because it's difficult for people to stop. Oh, right, okay. Sorry, apparently my mic was echoing. So yes, I think we interviewed one person roadside. But we did interview 8 people who were highly mobile, and I think that's given us that perspective in the work. So there've been some encouraging signs. So we were addressing concerns from last time, which were high stress levels and benefit underclaims. So we have got increased benefit receipt, positive links with education, increased dental registration, but there's been real lack of progress or a worsening of the situation in some areas. So mental health concerns, and they have risen. So as I said, half the sample have mental health concerns and 2/5 have debilitating symptoms. And the high levels of racism and differential treatment is really shocking. I would use that word as well. And it's much worse than 13 years ago. We have to do something about that. We noticed that relationships had become impaired. So 13 years ago, CHAWREC were doing lots, I think 50% of their taking legal cases about discrimination were with Gypsies and Travellers, and there were some really good wins at that time. And funding's changed. So, it's hard to take a case now because you have to pay for it. And so that type of relationship and the trust building that goes on when you're working with people, it hasn't been there. And I think that undoubtedly affected our ability to get people interested in participating in the work. So austerity, changes to legal aid, services being cut back, and a loss of faith, perhaps, when people haven't seen a change. Positively, we've got all this information on things that are affecting communities, and we knew that those were problems last time. We couldn't ask the questions. We were able to ask the questions. People were really keen to tell us, and now we've got that data. We need to do something with it. And that's been a really surprising outcome. I think it's a big step forward. And in addition, we asked people, would they be willing to join some consultation panels? Would they be willing to talk about their experiences? And yes, they would. I think that certainly a quarter of the sample said that they would like to. So again, that's a positive, and we need to work with that. So points of learning and where to now. I'm not going to go through all of the, I know I'm short on time, I'm not going to go through each of the recommendations, and I think that perhaps Wim will talk about some of those. But I think broadly they fall into two categories. That we should, it's about forging bonds and building trust and perhaps repairing those broken bonds and improving resilience in the community. And we need to listen, and we need to understand, and we need to keep on listening and listening to each other and building that trust up and finding out more about these things that the areas of concern and doing more about them. So we need to understand more about those issues. We need to understand more about the connections between exclusion, racism and mental ill health and the impact of social media. And we didn't put that particularly in the research, but undoubtedly there's an impact on social media because it's bringing what was formerly private, it's making it public, it's affecting the culture. And understanding more about the increasing prevalence of suicide in these communities, which the communities themselves cannot understand. We need to do more work. And I just wanted to put this quotation up because I think it's wonderful. And it's, in terms of isolation and exclusion, I think it just hits the nail on the head, and I'm going to finish with that. That people view us with suspicion because of the way we dress and speak. People make assumptions about us and follow us in shops and ask us to pay up front for services. We're all tarred with the same brush, it's shameful. There's a ripple effect. The settled community make assumptions about us, and we, because we have these experiences, make assumptions about the settled community. And this needs to be broken, I think. I think it's behind a lot of the differential treatment that people face. So I'm going to finish there. And I'll be happy to answer questions later on or via email. Thank you.
Yeah, and I can make me host again. So list the participants. Yeah, and then find me on there. Right, I'm just swapping hosts around there. Sorry. Sorry, I'm sitting in a room where if you sit very still, the lights go off. So I've just had to get up and wave at the lights. Apologies. Am I okay to share now, Chantal? No, not yet.
Sorry, Wayne, I was just trying to get back the host because I think you have to be. Can you try sharing your screen? See if you can do it.
I have done it. It says only host can share. So sorry, Chantal. Yeah.
Yeah. Okay. Oh dear. Let me go and sort out because I've had to share hosting with another computer.
The technical joys, folks. I mean, it's all it's all here. Please don't judge us on our computer linky skills. As you can see, that report's incredibly professional, and so are we honest.
Doing grand. It's great.
Thank you very much. Thank you. It is all just the modern joys of a COVID and post-COVID scenario. The problem is you can't even chat to each other, can you? That is the shame of this, because normally when we're waiting, we just,
Right.
we're
Now,
able to chat.
I'm now host, and I can now allow Win, wherever you are. There you are. So I'm going to have to pass the host over to you.
Okay.
So that you can share.
Lovely.
And you should be able to share now.
I can indeed. Just bear with me, folks, while I get this up. Oh. Sorry. Back to Zoom. Share content. Oh no, that's the wrong one again, sorry. I can't even get back now. Sorry, I don't know if you can see anything, but it's not good. I'm in the wrong place. I can't even get back onto the Zoom now.
No, we can't see anything yet.
No, no, that's the wrong, I'm in the wrong place. I practiced this morning, and Chantal and I did this last night. I can't even find where, there I am. Right.
There's you. I can see you.
Share content. Right. Sorry for this. I should be in my iCloud drive. There it is. ICC presentation. It was just me. That was actually a memory lapse, folks, because I couldn't actually remember where I'd put the thing that there's 3 people entering the waiting room, so I'm not sure how I let people in. I'm going to go into participants and admit everybody now.
Yeah, that's fine.
There we are. There's 3 people entered. Hi, my name's Wyn Lawler. I am the Strategic Policy and Partnerships Manager for Irish Community Care. And I'd also like to say just a very quick thank you. There's a few people without whom this would not have happened. As Chantal said, it happened ages ago. 2014, 15, we started talking about this. So thank you to everybody who's committed funding. Thank you to Dawn Taylor, who has driven this and allowed us space and access to rooms and community, you know, sort of our community accesses in and out through our drop-in to do this. It's been quite a complex piece of work. So where are we now, and what's the impacts as a community organisation? So this is about us, what we've decided to focus on, because a lot of the other stuff is in the body of the work that you're going to be reading about. Everybody's going to receive a copy, either electronically or hard copy, whichever's best for you, or both. So what we wanted to look at were, what were the positives as a third sector organisation? So basically, having a charity involved, having a third sector organisation involved allowed us to access additional funding from Awards for All. So that really, the big lottery really facilitated us to be able to do outreach, to travel around Cheshire and to access people in their own homes, particularly where, you know, we are talking about women under 40, they mostly had children. So asking people to come to a space, and that is something that is, I think, worth noting, that was quite different from the first research. The first research was done and an invitation came out for events. We did the same thing here to start. What we discovered was that we had 2 to 3 people on average at each of those events, and that was surprising to us, and it was also surprising to kind of Chantal and Corinne, who'd done the work before. That was different. And I think it reflects the fact that people's lives are so much more busy, that the pressures are so much more, that there are different kind of requirements for people when they are functioning, and there are different levels of what people feel they need to be able to function. to access services in society. And I think, as a lot of you are service providers, that's something to really think about. How are you going to engage with people on the longer term? So I'll just leave that thought with you. What we found was that actually going out to people was the best way. Having said that, we needed to go with trusted persons, and I'm not a frontline deliverer. I also relied on Maya, so thank you, Maya, for driving us around quite a lot of Cheshire. We saw some back lanes and interesting roads when we were trying to find some of the smaller sites. We actually had somebody come out with about 10 dogs and a cracked shotgun at one point from a private building, private space at the bottom. Nothing to do with travellers, but we'd obviously, there were big trespass signs up, so we reversed very quickly out of there. So we have some experiences that we can share with anybody who is keen to do outreach. And I think, you know, building on our knowledge that we glean on a daily basis and from doing this work is quite important. So we were the trusted community link for many of our participants. Irish Community Care has been working in Cheshire for the length of the life of the Gypsy Traveller service. I started as the first Irish Traveller outreach worker. So we started back in 2001, just very basically getting phone calls from extended family and saying, oh, we're on an encampment in Cheshire, is there any way that you can help? We're in Ellesmere Port, we've got a child in hospital, we need a stop. And people, so we started doing negotiated stopping, and then Dawn Taylor, who we knew from working in Liverpool, started to work for Cheshire and became at that time the only anti-primary Cheshire staff member working with Gypsies and Travellers. So we've built a relationship and rapport with Dawn as well, which I also think needs to be taken into consideration when we're talking about this work. So ICC's accessed Gypsy Traveller homes on private sites, developments, and a development is something where there is not permanent planning permission. So as you can imagine, a lot of people were quite nervous about letting people onto those sites, and we got access. And I know that we've had access where, for example, you know, council officers would not have had the same, or other services that were not known would not have had the same welcome. So it was really, really positive experience, and has helped us to build our relationships ongoing. Obviously, we now need to feed back what's happening to our community to keep that trust as well. And that's something that really needs to be thought of going forward, how we engender and build on the trusts that we've got with our community. As we can see, we were given key insights as to why people did not wish to be involved with the research. So the next slide and the one after is looking at problems that we encountered and barriers for people being engaged in the research. I think Corinne's touched on many of these. But one of the key cultural issues was that the main period that we got that additional big lottery funding for started in June. So Maya was able to start to outreach. That's quite a difficult time for many of our families. The families who do have children in school also want those children to experience a cultural, kind of positive cultural experience. So once summer holidays start, and really from early June, we have Appleby Fair, which kind of triggers the start of summer, really, historically and culturally for travelling communities, and that's when people start to move away and to move to other places and to enjoy and share and link to their cultural heritage. So a lot of people were not available because of that. We also had the point that's been touched on. We've had quite significant traumas over this period. For the life of the work that we have been doing as a community service, we are aware that there are these impacts, and anybody who's worked with Irish Community Care on health engagement through Ellesmere Port, I know Joe and Alison and other partners who are here today will have had that experience of me saying, right, we're planning this day, but if something happens, you need to be prepared that we may not have anybody at all attend. And that is something that is really, really important to take into consideration and to plan for. And if you've got that in your prep and your planning from the outset, you're not kind of taking it as a personal situation when that occurs. But that is something that we have had to accommodate in the research report. And many people who said and expressed an interest initially in being involved could not be. I mean, there were 2 sites where people were in lockdown mourning and could not leave the site because somebody was either seriously ill or had sadly just passed away. So in those situations, you know, all you can do is give your condolences and offer to support where needed and you know, not proceed with the research. Some families on private developments with temporary planning licenses didn't want to take part in case it affected their planning permission and their court cases, and that's something that we hear a lot. Another side of that was that people we knew who hadn't received planning permission or that hadn't been made permanent where they felt that it should have been, also said, what is the point of being involved in this? You know, we're here, people know we're here, we've gone through a planning process. And they had completely disengaged from the process of being part of wider community, and we're just in a kind of a reconsideration of their own personal circumstances and dealing with the health fallout and the psychological fallouts of those kind of things that were happening to them, and did not feel conducive to sharing any of that outside of their families. The other thing that we noted was that there was a ripple effect if one family member did not want to take part. And that was particularly significant with key community members. So if there's a mum, for example, who said, oh no, I don't feel that that's something that I can do, that would be significant for her children, but also for example, for her daughters-in-law. Not so we would have a kind of a situation where we'd have significant gaps, really. Having said that, I mean, you know, this is all talking quite negatively. We've got 125 people to say yes, which I think is awesome, and actually is higher than the 2006 research figures. And it's an absolute baseline to be looking at you know, greater and more inclusive work going forward. And I think before we go on to the next barrier around that, again, the other thing that Corinne pointed out is the fact that actually we don't know the data. We have an extrapolation from the census in 2011 around how many gypsies and travellers there are in Cheshire. And that is the number of people who were willing to say. As we know, there were only 50 from 125 who are willing to say, who were part of this research, who would complete Gypsy Traveller ethnicity and would say that they were gypsies and travellers. And there were some people who varied depending on what that circumstance, that particular situation was. So what we're looking at is a great unknown. What we do know is that Irish Community Care, for the work that we've been doing, which has been part-time in Cheshire, you know, we've had drop-in for the last 9 years. We know that we are still only reaching to the kind of the very point or pinnacle of a very large unknown kind of shape, and that there is a lot more need out there, and there are a lot more community members out there. So other reasons why people did not want to engage was that they felt that there was no point. You know, and that was for a lot of reasons. You know, and that is the weight of day after day, kind of banging your head against a brick wall. You know, why do people want to keep doing that? And they had reconciled their experience and their life and their living to actually manage whatever the situation or the circumstance was. It might not be perfect, and certainly, you know, looking at the data, there is, you know, there is nobody's life is perfect in the 125 people that we talked to in any way, shape or form, but they have managed to survive and got to a point where they're inured really to the circumstances of their life. And sometimes to rock that and shake that is actually as traumatic as particularly when you don't know what the outcome is, as doing nothing. You know, doing nothing becomes kind of the kind of what you know you can exist within, and that's about marginalization and exclusion and all of those things. So we have a big issue, you know, and we have to address that, all of us together. And I think it will take all of us together to convince some people that there is a point, you know. People had also said, well, we were part of the last one, or I know somebody who was part of the last one, and nothing's really changed for us, has it? You know, we're still, you know, struggling to make ends meet. We're still dealing with the same issues as before. So why is that? Why is it important to get involved now? And we did try, you can imagine, Maya is a very convincing person. If you've anybody who's ever listened to Maya or myself trying to persuade you on anything, it's hopefully difficult to say no, or it is, you know, but when we're at our best. But, you know, some people felt that they had to say no. And people feeling that discrimination's a norm, so nothing will change that. And these are really sad statements. I think that, you know, we can't just go, well, it's okay to leave that for the next 10 years. It's okay to leave that for the next 15 years. I do feel that, you know, we all need to be working towards doing something about that. As we talked about that percentage of data, looking at the future, what I will say is that coming out of that Awards for All, that £10,000 that we got, we started a dialogue with Big Lottery and the community programme. So we have had some developments just by being involved in this, just by having some very draft data that we could share with them as a funder. And they have recognised the weight of the work that CHAWREC and ourselves have done, and the partnerships that we're already working in, and the optimistic hopefulness around the partnerships that we will develop going forward to support and engage our community members. So we have actually we're in receipt of funding for a 3-year programme for a full-time project team, which we're currently in a recruitment phase with, and part of that is going to be a community development worker. We felt that was really important. We've got advocacy, advice and support. That is massively important. As we've seen, there's a change in benefits. That is down to advocacy, advice and support. But without that, all we do is we allow people to kind of engage at a point of crisis. We need to be looking to support communities to recognise their strengths, build on those strengths, and develop those strengths within their own communities to support themselves and to support each other in really positive ways. And as we've seen, you know, one of the things that has come out, there is a recognition within the community of the strength of their own community. That's where we got the most positive information. Yeah, we you know, we love being part of the community. It's really positive for us to recognise and support our Gypsy or Traveller culture through our own community links. And I think that's something that we need to develop as well, and to celebrate Gypsies and Travellers within Cheshire. So we're looking to be, you know, promoting really kind of positive community groups and community engagement and work with Cheshire. And I know Dawn's done amazing pieces and has got some fantastic stuff. If anybody saw the Roma boards that Dawn brought for Gypsy Traveller Roma History Month last year, they were hugely profound and really informative for Gypsy travel communities around kind of the experiences of during the war. And if we get a chance to do that again, Dawn, you know, we'll support you 100%. IACC and CHAWREC are committed to working to ensure community voices are heard in all areas of this study, and exploring with our communities and expanding our communities to shape and develop new conversations. So as I asked you at the beginning, you know, hopefully that's helping you to start to formulate within your teams and for your services exactly how we can do that going forward. Thank you for your time, and that's my presentation now. So I'm going to stop the share.
Thanks, Wynne. I was just going to say we are running over time a bit. I'm a little bit concerned because the Zoom meeting's only been scheduled until 12:30. So there is a possibility that we might just shut off at 12:30. I'm not sure. So I want to really try and get Russell on to speak as quickly as I can do. He was going to talk for about 5 to 10 minutes about his experiences, why he's got involved, because Russell's from the community himself. Do you want to unmute yourself, Russell? Do you know how to do that? No, he's going no. Do you want to unmute? Still on mute.
There you are. Is that me? Can you hear me now?
Yeah, that's it. Yes, I can hear you now.
Oh, that's much better then.
Okay, great.
Yep.
And Wynne, could you put me back to hosting, please, as well, if you can?
Right. When do I start? Should I speak now? Yes.
Russell, can I just ask how I stop being host? There we go.
You got me.
No, sorry, it's just asking me to rename, which is no. How do I unhost myself?
You basically go to my name, and beside it there should be 3 dots on the top left, right hand side, and beside the mute.
Oh, sorry.
And then drop down from there.
That should be it now. Sorry, Russell. Sorry to take your time again.
That's great. We're back with Wynne. Oh, I speak now, yes? Right, fantastic. Right, early life, left school when I was 8. Reason being I was several different schools, each school pretty much worse than the first. Bullied, not allowed to speak at assembly if I wrote a story out, somebody else had to read the story out. And the bullying in the end just got too much, so Dad said, well, enough's enough. We've tried every shape, we'll educate you at home. So we were free stopping in Shifnal in Shropshire, and he came down and made us go to school for a week. And well, my brother was basically bullied again. And if we fought back, we were given the slipper or the cane, and if we didn't fight back, obviously we got a good drubbing. So that's enough, no more school. As regard to the stop and search, when I got older, we were working for ourselves. I've been stopped numerous times for no other reason than just being in a van going to work. And when we've been stopped, reason being stopped, oh, well, you fit the description of somebody in the area who's done something. Have you got any idea? And have you got proof of who you are? I've got insurance details. I was once stopped in Saltley in 2005 driving a car. And when I saw the white stop, he said, well, your car's dirty. Criminals drive dirty cars. So, and as soon as they stop you, with all due respect, with the accent, the first thing they do is, can we have backup, please? So I was held outside the road for 25 minutes on that occasion with 2 police cars, stood outside in case I did a runner or jumped in the car, and not pleasant experiences, to be honest. It's not all bad, obviously, and it's not all police are bad, but some of them are pretty bad. Getting to a couple of points here with how I got involved. My brother-in-law, Joe Hearn, he started doing some things with Gypsy Travellers, and we got talking. He said, well, to be honest with you, I said, it's pointless. It's it's pushing the elephant up the stairs. He said, well, if we all have the same opinion, he said, nothing's ever going to go forward. He said, we've all got to try and do a little bit. He said, hopefully all the little bits together make into a big bit. He said, there's people trying to help us, but if we don't try and help them, he said, how do they know the situation outside? They've got somebody on the inside trying to help as well, which Corinne's just put it across very eloquently of the help that's being put to us, and we must now try and help and push it forward ourselves. I had Jill Broomhall mention over the transit site in Cheshire East. Just to elaborate a little bit on that, in 2014, my family owned some land at Smallwood, and we were approached by the council to put this forward. And it was just basically, oh yes, super duper, great, it's in a great position, everything's fantastic. But instead, they decided to go to Cledford Lane. And we've actually had to give police interviews to, under caution to the police, because apparently there's some sort of corruption going on, because Cledford Lane site is still, in 2020, no further forward than it was in 2014, 2015. And obviously there's a dire need for a Travellers transit site because of the amount of stuff that goes up and down on the Barony and other places. But the site at Cledford Lane is literally in a dangerous position, no public footpath, bad access, there's no accommodation for children, for the elderly, for anything at all. It's just basically, let's just sweep it under the carpet and take it away. And this is what we find with everything. My own family trying to get the same land passed now in Smallwood. We've had it passed for 4 families. We had, it was going tickety-boo, and we were trying to get the permission sorted out. We won on appeal. And then the parish council decided to take it to the High Court and then the Supreme Court to try and say we weren't allowed to live there because of schooling or some nonsense, which was a bit farcical when there's affordable housing being built for families in Smallwood Village, which obviously where they're going to go to school. So it seems a bit as though they're hypocritical on that. But in the meantime, we've had person or persons unknown come down, and the home I was living in has been ransacked, vandalised, smashed up. 5 other caravans were smashed up, and my car, which is now the A4, wasn't a new one, far from it. Every window smashed out, every panel damaged, racist graffiti scratched into the bonnet of the car. They've been down since that. They've ripped the letterbox open, scattered mail, stolen mail, you name it. You know, tins of paint just tipped over, windows being broken on other caravans, and things have been repaired, just being general nuisances of themselves. So we've had the police down involved in each and every occasion, and I think it was Greg Thompson, the Gypsy liaison police officer. He advised us to put in for more permission to all the safety numbers. So we've put in for 4 more caravans, so there'll be 8 families altogether. And small parish council have decided notes and wrote into the council saying, well, Cheshire police didn't take this matter seriously at all. These things didn't happen. It's just fabricated. And the police just looked and just poo-pooed the idea that any crime had been committed. So we had to interest them back in touch with Cheshire police. But this is the level of racism and bigotry that you face with all the time, that the parish council is supposed to act for everybody, and yet straight away, oh, we don't want them in our backyard. We want a site, but not here. Oh, we want the people to live, but not within a 5-mile radius of where we live. Part of the planning permission for us has had to be screening. We mustn't see the caravans, we mustn't see this, we mustn't do that, or we must have low-level lighting. Yet across the road from where the site is passed, which passed for 4 families, there are caravans, there's touring caravans, there are mobile homes, no objections to these. So why is it different? It's not the caravans that people are objecting to, it's the people living in the caravans. Over the unforeseen racism then. In Sandbach, we have a Waitrose superstore. We frequented often, to be honest with you. We went there on Saturday, walk around the store. Now, I'm not saying this chap was deliberately following us, but every time I turned around, the security guard was stood behind me. So he was either very, very conscious of my security and the safety, or he thought that I was obviously the one of the usual, he's a gypsy, he must be stealing, which couldn't be further from the truth. My niece, Maria, should have been here today, but she's a single mother. Her and her husband, they had the disagreements, and she set up her own home. She's got 2 small children, but she's not the usual stereotype of the freeloading gypsy. She works, and she applied for time off work, but she could have got it, but it was a little bit sticky. So she said, look, I'd rather not. I don't want to lose the job. She doesn't want to be a burden to anybody. She works taxpayer herself. These aren't the normal stereotypes that people like to see. They like to see the gypsies being used somewhere. Oh, more freeloaders, more people we're not going to pay tax or council tax post yesterday, whereby we're closing the seaside amusement stand and everything down because there's it could be an invasion of travellers. Joe Hearn put at Hampton, we're going to close the Billy Jamie Drum down because there's a gypsy horse fair close by, and you know what they're like, we're just going to get raided. Now, I'm not being disrespectful. Can you imagine in Sandmarsh we have Black Lives Matters protests? Can you imagine if all the shops, as I said, well, on Saturday we'll be closing from 9 till 1 until the protest's over because we could have lots of black people smash the town up. It'd be totally out of hand and wrong. It wouldn't be fair. Yet against us, it's accepted, and people just say, "Oh yeah, well that's right." I've put comments onto Sandbach Life, my local little thing on Facebook, about some of the vandalism going on. And basically, I put some of the photographs of the damage. One, oh, you want to be careful so they don't come back with some petrol. Now, when somebody's had the home smashed up and all the possessions basically scattered to the four winds, that's not really a nice comment to put. What kind of person would say that to another human being? And not all the comments were bad. One person wrote on there, he said, "Hey Russell," he said, "I've got a postbox, this heals is damaged." And in Sam, she gave me a postbox. So it's not just all the negative. There are some positives. But unfortunately, people have to try and look for more positives in both sides of the fence. You can't just simply say all gypsies are good, because there are some bad apples. But they're not all bad apples. There's more good than bad. I was looking here at some of the comments being made over the survey. I was going down asking people to do the survey, and people are saying to me, "Well, look, Russell, we did the survey before. My mum did the survey. What's happened? You know, I'm going to the shop, I get followed around. I go do some work. As soon as I find out we're travellers, I'm being chucked off the job. You know, or they've done the job, and we're not paying you. You gypsies. You should have said this when you started. But we've done the work. We're happy with the work. Yeah, but go and call the police. What are they going to do to you? Nothing. Go on, off you go." I said, well, if you don't try and make these little steps, it's going to keep on going. It's not just for us, it's for children, for their children. Everybody's got to try and step forward now and try and stop this negativity and stop this abrasion between the two communities. Myself and my father went to a little meeting in the Middlewich over the transit side of Cledford Lane, and waited till the end of the meeting. I stood up, saw them where I was, and I was part of the community, and offered myself available to speak to any members of the council regards the Cledford Lane transit site, or to get perspective from the travelling community. Because I was saying, oh, nobody from the travelling community wants to come forward, nobody from the travelling community wants to help us or to put forward any ideas. After a couple of handshakes, oh yes, great, oh fantastic, lovely information, we'll be in touch. Yeah, I've got your phone number. Oh crikey, look, we definitely need the input. I have not had a phone call. So obviously it's just lip service. Now, these things have to stop. Over the mental health issues, my cousin Tyson Fury's the heavyweight champion of the world. He's come forward and he's actually spoken, a man 6'9", 20 stone plus, and said, I suffer with mental health. He's tried to break down the barriers. But him, after he was up in Morecambe, and he'd very stupid, he was going to a press conference, and he was in a hurry. Motor was blocked, and he went on the hard shoulder up a slip road. He got pulled over. He admitted it, hands up, yes, he said, and Tyson Fury, there's me drive license. 99% of travellers now always carry the drive license or some form of ID, because we're sick to death of being taken into the cells and held. He said, that's who I am. So he right, expect the fire in the post. In the meantime, we moved from one house, not a side of the road, one house, to another house. Now in Morecambe, he's a very well-known celebrity. So he was signing autographs in the McDonald's with these small children, and two police officers came up to him. So I said, and he does an awful lot with the police as well, by the way. He's a really, really nice guy. Oh, he said, would you like a photo? He said, a photo op, guy. He said, do you want a selfie? Tyson Fury. Yes, he said, obviously. He said, we're arresting him. He was taken in the back of a police car and held overnight up in Scotland to go to court to pay a £90 fine. Now, can you imagine if that was Anthony Joshua? And I'm not saying that Anthony Joshua is bad because he's black. I'm just saying everybody should be the same. It doesn't matter the man's skin, the gender, anything at all. We should all be treated equally. We should all be treated good. If somebody's naughty or bad, then held hand up, say yes, if they've admitted the crime. But don't castigate everybody immediately. But it was Tyson with his mental health problems. He's come forward, he's spoken about it. You don't hear him being spoken about. You don't see anybody trying to approach him, or these charities trying to say, would you like to be our spokesperson? Would you like to be our champion or anything at all? You can, whichever way you put it, because they don't want to be associated with the Gypsy Traveller community. And these are some of the stereotypes that we face all the times. On about the forms. I'm 50 years old. My children, when they did that we put onto this forms, Gypsy Traveller. At my doctor's, I'm white British. At the dentist, I'm white British. Everywhere I go to, they ask me, oh, white British, yes, white British. The reason being, and if you want to do this as a little sample, just go in, change your doctor. Well, that's maybe not a good idea too, but change your doctor and on the phone, put in Gypsy. English Gypsy or English Traveller, whatever you want to put onto it, whichever you feel more comfortable with. And you look at the receptionist's face as you look at that form, or the next time you go in, you just look at that, gauge that reaction and the difference. You look differently, you treat it more with suspicion of, you know, ooh, I wonder. And that's the problem. Or with people trying to get out these little research documents done, it was very, very hard. Because they'll say to you, the amount of people I spoke to, and they said, well, Russell, the Nazis did this in the 30s. They came out, and it was all done on the pretense. Why am I going to put in the form that I'm a gypsy? Then the next thing they'll come and knock on my door and take me away. Why am I going to do this to go into the doctors? So they'll be in that place, knows I'm a gypsy. And then all of a sudden, they're closing the handbags or shuffling away from me because they don't really want to sit next door to me. And I try to say, well, if we don't do it, we don't get counted. They don't know how many sites to put for us. They don't know what provisions to make. And they say, so the more this is, we'll leave that to the next person. Let them do the thing. Don't like this stigma. And really, I don't know what we can do to try and break the stigma down. Because with my own personal experiences, you can go into a shop respectably dressed and you've got a credit card on, you're paying with cash money, and you still get, well, as I say, Saturday I was found around Waitrose, not for the first time and obviously not the last time. It got so bad, my mum and dad live in Winsford, that the local Morrison store, my mum actually spoke to customer service. She said, I appreciate the care and consideration from Morrison's. She said, the security guard doesn't need to follow me around. Oh, I'm sorry, I think there was some mistake. No, she said, each time he comes around, she said, I turn around, he's behind me. There were another family in there's a Hamer, and the wife is a woman called Connie Ward, which is now Connie Hamer. And I actually witnessed with my own eyes. This was just before the lockdown. And they went to the self-serve payment. They paid for the shopping. The person who supervises these little payment things watched them go. And you could see them looking at them basically, well, I wonder what they're up to. And then she went down, she went on the screen and touched to see what they supposedly bought. And in her mind's eye, what they actually had. And it must have collaborated because, oh, yeah, she walked away. Why did she do it to everybody? What was so different with them? And I'm not trying to pick on us, it's the negative part of it. But I've been asked to talk about my own life experiences. So we've spoken to different people, and their experience has been horrible, just as not all mine have been pretty bad as well. It's not really very good. So I'll say, well, I appreciate being allowed to speak my little two-penneth worth and say these little things, but it really is hard. The people here in the centre, they've helped me. They've written to the parish council and asked them to retract the comments. Basically, in Cheshire Police, I believe, have been in touch with the planning department at Cheshire East Council. So, on that note, I think I shall wrap it up and pass it over to Chantal. But thank you very much for attending.
Thank you, Russell. Much appreciated. Without Russell, I don't think we'd have got half of the amount of people that we got through the interviews. I was a bit worried that we were going to all just shut down at 12:30, but it's allowed us to run over, so that's good. I wanted to run through, I think I've got questions down next. I've got a couple of questions, but not much. Mostly statements, really, very supportive statements, really. Russell, thank you for being so open and honest about everything that you've been through. Big thank you to you for speaking today and making the effort to come down here. So the questions that I've got a couple. Is Dawn still here? Is Dawn Taylor still here?
Yes, I'm still here.
Could you answer there was a question in the chat, I don't know whether you saw it, but it just said, why is the Traveller ethnicity used in the title of the council encampment team? As this team work is mainly with the fifth or less of the GRT community, why is the ethnicity relevant when it's a housing issue and subsequent causal issues? Whilst a side issue, the common misuse of the ethnicity in titles such as this marginalises and prevents effective engagement. Some excellent work on the East recently with councillors publicly supporting site provision. I thought maybe you could respond to that.
Yeah, we don't just deal with unauthorised encampments. We deal with site provision and house travellers, health, education, lots of other issues. And I fully agree that hopefully eventually that we won't have to have the words Gypsy or Traveller in our job titles, because you don't have that for other groups. But I think because we were a new team, the Cheshire Warrington Traveller team, and we are sub-regional, it was so members knew where they could come and the public. But I agree, eventually we would like to not have those words in our job titles, but we certainly do a lot more than just unauthorised encampments.
Okay, yeah. Does that answer the question? I don't know who actually asked the question, because it just came up with the phone number.
Martin Campbell.
Oh, right, okay.
Mm-hmm.
Right, and then the other question that I had, which I think is probably for Wyn really, is whether there will be Gypsies and Travellers employed in this new team that you've got. Wyn. You're on mute. You're on mute.
Sorry, that's quite unusual for me. We are, shall we say, we are optimistic. We have community members who have applied, and that is something that is really exciting. It means that our reach has been as wide as we needed it to be, and we will be recruiting in hopefully sort of so that staff can start before Christmas. So it's watch this space is what I would say. Watch this space. We certainly don't have as many people applying from the traveller community as we would like, and I do think that that's something to do with the state of secondary and ongoing education and access issues. There's universities have identified that actually the figures of Gypsy travellers going to university have just reduced, which is tragic and a massive waste. So yes, we look very favourably upon community applications, and we send things out through our community networks to ensure that as many people as possible who can apply from the community are able to do that, and we facilitate and support. I mean, Bridget and myself have been available during the recruitment process for conversations, for example, to encourage and support people to apply who had queries or questions about that process. And I do know we've spoken to community members through that process too, and encouraged them to continue on to apply. So we have got applications from community members in, and it is about making sure that the best person gets the role, and there is a broad spectrum of questions and processes that we go through to ensure that that is the outcome. So I'm really hopeful.
There's a comment.
I'm on the recruitment panel with the team. So
there's just a comment in the chat, Wyn, which says formal education or lack of it shouldn't inhibit the employment of those with relevant life experience. And Steve just asked where's the post been advertised? That's the other one.
It was advertised through our community networks. We got it out through our partners. We got it out through, it was a whole range of different areas. We link in through the universities as well. We're not necessarily, and one of the things that's interesting is we ask for a degree or equivalent life experience. We don't ever, even for the project coordinator's post, we're not expecting somebody to rock up with a degree. You know, it is, you know, not all of our staff who are currently employed have a degree. It's not a requirement for the post. We are looking for, you know, emotional intelligence and life skills, and an ability to, you know, to be able to do the job in an accessible, inclusive way. That's what we look for across all of our team when we're looking for all our staff.
Just been asked about whether or not you can share the advert the public sector? So
The process is closed.
Oh, okay.
Sorry. It's and that's what I say. We're at the recruitment stage now. That's how I do know that there are community members we have applications from. We are working towards making sure that we've got a recruitment dates. It's quite difficult because obviously one of the other barriers is, we're in a scenario that not everybody within work systems is comfortable with either. So, Zooming in interviews, it's a really difficult situation, isn't it? It's not human, is it? And it doesn't bring out the best in lots of different people, not just people from Gypsy Traveller communities. So we are looking at ways that we can do things humanely through this COVID process. But at the same time, we've got the funding and we know that we can start the process of getting people employed and engaging in the community. So it's a very difficult situation. Do you sit on the funding and wait for COVID, or when would that be? So we actually made the decision to go out, supported by our funder.
And I've got another question about whether there is going to be, let me just see what it says. Is there any video training that we could make available for officers who have contact with the community? And I think that was from Kathy. We've got a response there from Cheshire Constabulary are already in preparation to do this. There will be awareness session to tackle this issue. First to get the training will be beat officers and PCSOs on all 122 beats. This should improve our understanding of the community, improve engagement and service delivery, build up trust and respect, giving the confidence for all to challenge prejudice internally and externally. So thank you for that. But is there any other training that anybody else is aware of that people might be able to access? I know Dawn does quite a lot of training with counsellors, for example, and I know when you do training as well. Is there anything you want to expand on?
Yeah, I would love to say, if you are receiving training, please make sure that community members have been involved in the design and the development, if not the delivery of that training. It's much better. As the amount of thanks for Russell and his life experiences, it's an incredibly powerful thing to sit and listen to, and a community member talking about their life and exactly the impacts of identifying as Gypsy or Traveller, and the effects that has on their day-to-day. And so when you're looking at training, I do feel that there needs to be we need to make sure that it's a standard of training, and that people are getting a good quality of training, and that there's a quality assessment process in that. I would say that community members are delivering that, and they are designing and developing those processes. So please, wherever possible, make sure that is where your training is coming from. There's a lot of professional bodies out there who are talking from the experience of being professionals, and it's not the same sort of training at all. So if it might be more suitable for what your organization's needs are in the first aspect, but you've just heard the power. So where possible, engage with the community to do that, please.
Dawn, do you want to mention anything about somebody's put begin access to the CHAWREC training package from Dawn Taylor, be delivered by a member of Gypsy Traveller community? Do you want to expand on that at all, Dawn?
Yeah.
Oh, hello. I can see you.
Hello. We've done an iLearn, and we launched it in GRT History Month in Cheshire West, and it's going to the other authorities, and we're just tweaking it for them and for the police. We're also doing work with the PCSOs and the beat managers. So if there's a traveller site in their ward, then they will be visiting it as they would any other area to say hello to people before there's an issue, so that they get to know who lives there, and they would have a cup of coffee or a cup of tea with them. The other thing is that phrase that travellers are using at the moment, nothing about us without us. I fully believe in that, and the iLearn has got 2 members from the community speaking on there about their experiences, and I would like to get a pool of Gypsies and Travellers who would be happy to do training alongside myself, 4 members, for education, for health, and obviously they would be paid the going rate as anyone else who was delivering training. So that might be something we could look at that comes out of the people that have worked on this in the future.
Yeah, definitely. That sounds good.
Yeah.
Yep, that's all I've got to say.
That's
Wayne, go on.
That's certainly something, Chantal, and Dawn, that we're looking at. And, you know, the community development work, this is exactly what it is that we want. You know, it's asset-based community development. It's developing the skills, the abilities. You know, the community very openly and very clearly explained what their issues are. You've got the results in this research. People know what the issues are for them. They know what, you know, some of those solutions are too. They just can't elicit solutions by themselves, so are stuck into these, you know, into the situations that they're in at the moment. I think, you know, that's what we need to be. We need to be solution focused. We need to be community focused. The community development work and, you know, things like iLearn and FFT have community training. And there's, you know, for Gypsy Traveller Roma History Month, we're really lucky in the Northwest. We've got Richard O'Neill, who's one of the most fantastic storytellers. You know, we've got he can work with our communities too. You know, this isn't just about Irish community care. This is going to be, you know, it's a community effort. It's a county effort that we need to put in to change things for all of our community members, you know, based upon the evidence of this research.
Somebody asked as well about schools. Does anybody know about schools? What's sort of been going on in schools at the moment?
One of the biggest issues for Gypsy and Traveller children has been access to school while the lockdown was on, because we've struggled with access Wi-Fi and access to the internet, and also how to mums and dads asking and families asking how to support their children when their literacy is quite poor, the adults' literacy is quite poor, and trying to support their children. And that's been an additional struggle that, you know, parents have had, and of course any gapping is going to increase, so that when children go back they will be even more behind. And we do know, I know Traveller Movement have done some research on this down in London, and yes, there's been significant issues and significant loss of age group, you know, kind of learning.
I think
tracking.
I think Viv's trying to come in. I think Viv, you're trying to go. Yeah, go on.
Yeah, thanks. So I'm from a volunteering organisation called Passion for Learning, and we have been very focused on the needs of all vulnerable children who were really impacted by schools being closed since March. So our normal work happens in schools during the school day and through after school enrichment clubs, which we have running across Cheshire West and Chester. So we made sure that I had some conversations with Antoinette, who I think is on this Zoom. So we made sure that we provided a series of learning resources via Hornsmill Primary School for them to distribute to the families who they have within their school community there, who we knew were going to be struggling to access online learning, as a number of families did, whether they were Gypsy and Traveller or not. So that's the reason I'm here today, is to say that our work continues. We are in the process of getting volunteers back into school to help the children who have been so impacted by these missing months. And we think, you know, this is a community who's going to be more impacted than many.
Yeah, definitely. I don't know whether Antoinette wanted to come in at all and say anything about schools. I think she is still here. Give it a second. No, maybe she's gone. I know we've lost a few people because we've run over time. As we are over time, quite a way, we're 20 minutes over. Can we wrap it up? Is there anything, Wyn, that you wanted to add towards the end? Because we had said that you would maybe look at next steps.
Yes, thank you. I think some of the key things that have come out and have been discussed already. You know, to go back to kind of key agencies in this, we've got, you know, repeated kind of mental health, physical health benefits agencies, police, drugs and alcohol services, are all areas where we need to be doing much more joined up work, I think. And I think what we need to be thinking about as well is the internal cultural barriers. You know, it's about utilising all of our skills and strengths so that we can engage with people and reach out. I mean, for example, you know, Irish Community Care, people have always said to us, oh, Traveller men, no. Traveller men don't engage, do they? We've got, on an ongoing basis in Cheshire, we have between 38 to 45% of our any given quarter are Traveller men who are engaging with our service. You know, that it's sometimes things that are seemingly impossible aren't, and impossible is just a word that's used for we're not going to try. And I think we need to look at some of those kind of conversations that we're having about access and about engagement, and looking at how we can do that differently. I do think that barriers need better understanding. You know, it isn't just about saying, well, we've got ethnicity on our forms. And I think that's been a key part today. Russell, I think, you know, your conversations has been amazingly enlightening for us all. And I think, you know, it's not enough just sometimes to for community members to do what they are being asked to do. It's almost like there's unwritten rules that we have in society that we assume everybody knows. That needs to be part of training. That needs to be part of our conversations with our staff teams around how do we encourage and support people. This is being had across BAME conversations. These are BAME conversations where you have language as not English not as a first language, but I think we need to broaden our scope, because language is used in lots of different ways as well, and how we use words is different depending on cultural difference. So there are cultural differences in how language is used, and I think, you know, using accessible language, using I mean, one of the things that we did was we didn't actually use the words mental health in this research at all. And I think that's key. You know, that's how we've got mental health data. But we knew that using the words mental health would be a big switch off for a lot of people and a big fear factor for a lot of people. So it's utilising language in the right way, I think. Summing it all up, really, we need to be forging bonds, both ourselves, with our partners, with our communities. We need to be increasing resilience. This has already been mentioned by Corinne, and working to develop trust. But the biggest thing we can do now is go back to our communities, and that means all of us, Russell, doesn't it? You know, not just you, and saying, thank you for being part of this. Here's the next steps. So that's what we'd really like you to think about now. What are the next steps? What is some, you know, small kind of actions that you know that you can do, working with communities? Maybe it's identifying who you don't have in your services, looking at, have you got things like, you know, Gypsy and Traveller? Do you have posters up that make people feel welcome before they've even stepped through the door? So you're actually creating an open door before people, you know, have to knock, because a lot of our community won't knock. So it's about finding those ways to make people feel accessible, putting Gypsy Traveller Roma History Month, getting that out there so that you're talking to other people. Because one of the most horrible things is sitting in a waiting room and listening to other people talking negatively about gypsies and travellers when you are sitting there. And I've actually been with community members in that situation in hospitals and GP surgeries and other kind of outreaching spaces when we're supporting and attending with people. You know, people might not be talking about you, but they're talking about your community. That's incredibly discomforting. So, you know, having clear, visible access to challenge those stereotypes that we know are part of community, and doing that ourselves. when we hear people saying things is really a powerful way to interject and support. And to, as with Black Lives Matter, you know, Black Lives Matter's grown because there are people who are associates, people who are willing to support Black people, to give them ground and give space. And I think it is about doing that here with our communities.
Thanks, Wen. Just
very,
very quickly, there was a question about an area of about carers in the Gypsy Traveller community and whether there's any information that come to light during the research. I don't know whether you want to just touch on that very, very briefly, Corinne. You're mute. You're mute. You just made yourself mute.
Can you hear me now?
Yeah.
Hi. Yes, we've got a small amount of information on that, and I think that what we did find was that asking the question about caring and looking at the benefits that people were receiving about caring didn't correspond. So I think there were about 20 people that said that they were caring for somebody. I'm not sure all those people were in receipt of benefits. So we did ask the question. We asked, and I think that people weren't recognising themselves always as carers, would be my experience from sitting in drop-in and listening to the issues people had. That they weren't recognising themselves as carers, and this is where a service like the drop-in, you know, someone like Maya can say, you know, this is, she can articulate what someone is doing and point out to them the help that they can get, and so it's more about when she's in that session, someone might have come in with a form, but there's lots of other information they get when they're there, and she might be saying, have you taken your medication? Were you able to get a doctor's appointment for the person you're caring for? So it's really important that people have some contacts like that, people that can advocate for them. So yeah, there's a little bit there in the report.
Okay.
Yeah.
Thanks, Corinne.
Yes. Steve, can I just jump in there? One of the key things I think is looking at the census. I know it's massively out of date now, and we're looking towards next year for the next one. We are very much aware that Gypsies and Travellers are the largest group of carers, and they also do the greatest number of hours. And what's really important about that on a health kind of scenario is the fact that we know from other communities where there's been a lot more research that the people who do the greatest number of caring hours are the people who have the most health needs themselves, both physical and mental. So it's about, you know, if we know that from the census that you know, the largest number of carers come from the Gypsy Traveller community, then we actually need to be including that and as much as possible as information as possible. We're happy to do whatever we can to support with that piece of work.
Okay, I mean, what I should say is that, as I say, we will send out, we've got everybody's email addresses, so we will send out the slides, and we will send out as well a copy of or either a link or the PDF itself of the research. And we'd really encourage you to share that as far and wide as you can do on your own social media websites. And throughout your staff base. But I'd really like to kind of finish with Russell, if you don't mind. Russell, if you can take yourself off mute. Just wanted to ask you just to say, in one sentence, what you would like people to take away from today, really, what's important to you as somebody from the community.
Well, it's a hard one to say, really.
Sorry, I put you on the spot.
Oh, sorry. But I think that it's just very, very nice to be able to actually explain some of the situations that I find myself in. And I'm just not just a unique person, I'm one of many.
Oh.
I think that if people can just take away some of the experiences that I've had and try and put themselves in my shoes sometimes, and also not just judge before you speak to people. I think that an awful lot of people that are involved are already in that position where they're actually trying to help. It's hard to explain what I'm trying to say, but what I really would like to have to move forward is when we said over actually Gypsies and Travellers and becoming more involved with organisations, because, and I don't mean this disrespectfully, it's very, very hard for me to experience. I went over to America Until I went to America, I didn't realize what it was like to be a black person in America, where my grandparents or great-grandparents may have been owned by the person next door to me, grandparents or great-grandparents. It's hard to understand that. I actually spoke to people of color in America, and I associated with them. We got on well. And sometimes it's hard, with no matter how much research you do, no matter how much you talk to people, to actually know the life experience of people who've actually been in a gypsy or traveller, and walking into a shop, walking into a car dealership, just walking down the street, just driving in a car, mind own business, or walking up to a pub and being told, whoa, no travellers or gypsies allowed in here, or going to a restaurant that you've already booked. My niece Maria's wedding was cancelled. The reception was cancelled twice because the venue was, because it found out that there were travellers. And she had a call saying, sorry, Maria, you know, this, that, and the other, but we've had to cancel. Reason, well, you know, you're travellers. It's not acceptable. And it's hard. We take it as being read. We just take it as, oh, well, there we are. So now if you're booking somewhere, you don't let the people know until the very last, until you really roll up. I know travellers who, if they're going to rent a house, they'll have somebody like Corinne or somebody such as yourself to ring up for them, or actually go forward. Everything's all legal that they're doing, but as soon as you hear the accent or see the actual real person, it's like, oh, sorry, it's been let, or there's a problem somewhere. And
Thank you for that.
That needs to be stopped, really.
Thank you, Russell. Well, on that note, I would urge you all to share it, as I say, within your organisation when you get the information through, and to take steps, as Wynne said. I don't think we don't want it to sit on the shelf. We want actually people to make some changes to the way that they work and the way that other people work. And hopefully we will see you physically soon, and we'll be able to do some sort of workshop to follow up on that, and see what commitments people have made. So thank you very much for your time this morning. I'm really sorry we've gone over so much, and take care. Thank you. Bye.
Thank you, everyone. Cheers. Cheers.
Bye.
Thanks.